Let's see nephrotic syndrome. Before the exam, you must know about these points in nephrotic syndrome. In this video, we are going to see what is nephrotic syndrome, what are the symptoms of nephrotic syndrome, what causes nephrotic syndrome, risk factors for nephrotic syndrome, and complications of nephrotic syndrome. Hi, this is Dr. Pavitra from Dr. Smile Fresher YouTube channel. Please subscribe Dr. Smile Fresher YouTube channel. Welcome to today's session. So, what is nephrotic syndrome? It is a kidney disorder that causes your body to pass too much of protein in urine. So, first point you have to remember in nephrotic syndrome is massive proteinuria. Especially the protein level is more than 3.5 gram per day. So this is the key point to differentiate nephritic syndrome from nephrotic syndrome. In nephritic syndrome, there is also protein excrete in urine, but the amount is less, that is less than 3 gram per day. So in nephrotic syndrome, there is massive proteinuria more than 3.5 gram per day. Next, moving on to symptoms of nephrotic syndrome. So there is severe swelling, edema, particularly around the eyes and ankles and feet, and foamy urine because as a result of excess protein in urine. Weight gain due to fluid retention, fatigue and loss of appetite. These are the important symptoms of nephrotic syndrome. There is swelling all around the eyes and ankles and feet and foamy urine, weight gain due to fluid retention. Normally there is weight loss, but presence of fluid retention shows weight gain, fatigue and loss of appetite. Next, what are the causes for nephrotic syndrome? Usually it is caused by damage to the clusters of the tiny blood vessels that is present in glomeruli in the kidneys. So the glomeruli filter the body blood as it passes through the kidneys, separating the things body needs it and doesn't needs it. So the healthy glomeruli keep blood protein, mainly albumin. So here this is the important fact you should know. Normal glomeruli keep the blood protein, mainly albumin. This process needs to maintain the right amount of fluid in the body from seeping into the urine. So when the glomeruli is damaged, it allows too much of blood protein excrete in the urine, finally leads to nephrotic syndrome. What are the other causes for nephrotic syndrome? Diabetic kidney disease, minimal change disease, it is most commonly in the children, and focal segmental glomerulosclerosis, membranous nephropathy, systemic lupus erythematosus and amyloidosis. So next, what are the risk factors for nephrotic syndrome? First one is medical condition that can damage the kidney. Next, certain medications, mainly NSAIDs, non-steroidal anti-inflammatory drugs, and certain infections, that is HIV, hepatitis B, hepatitis C and malaria. These infections can lead to nephrotic syndrome. Next, moving on to complications of nephrotic syndrome. First complication is blood clot, and the second complication is high blood cholesterol and high blood triglycerides. Why it is increase in cholesterol and increase in triglycerides in blood? So in simple terms I will tell you, when the level of the protein albumin fall in the blood, the liver produces more albumin to compensate. That time liver also releases more cholesterol and triglycerides. So this leads to increased cholesterol and increased triglycerides in the blood. The next complication is poor nutrition. This leads to weight loss, but it can masked by edema. High blood pressure. So why there is increase in BP? So the damage to the glomeruli causes buildup of excess body fluid in the body. So it can raise the blood pressure. The next complication is acute kidney injury, because kidney lost their ability to filter blood. So waste products can build up in the body. So you need emergency dialysis. And the next complication is chronic kidney disease. Nephrotic syndrome causes kidney to lose their function over time. This may lead to kidney transplant. The next complication is infections. So these nephrotic syndrome patients have increased risk of infections. So this is all about nephrotic syndrome. So let's see what are the important points you should remember before the exam in nephrotic syndrome. The first point you should remember in nephrotic syndrome is there is massive proteinuria, that is protein excreted in urine more than 3.5 gram per day. In nephritic syndrome also have some proteinuria, but there is less than 3 gram per day. An increase in BP, increase in cholesterol, increase in triglycerides. So this is all about nephrotic syndrome. Thank you for watching. Please subscribe Dr. Smile Fresh YouTube channel for more lectures.